Thank you for joining us for Practice Advantage Pearls. We're delighted to have with us today Paul Louiselle, the Executive Director of Pediatric Surgical Associates in Minneapolis, Minnesota, a busy practice comprised of pediatric surgeons and urologists. So, Paul, as you know, the resources required to implement, upgrade, or change an EMR are pretty intense. We're talking about the time, the dollars, the hardware, the decrease in productivity for training. All those factors play a big role in implementing an EMR. So given all that investment of resources, what's the bang for the buck, or what's the ROI when it comes to short term and also when it comes to the longer look, maybe 18 to 24 months out? Can you share some of that with us, please?
Well, one of the things that we experienced right away within really the first week of go live was that our outsourced dictations essentially dropped to zero. And we didn't really anticipate that happening as quickly as it did, but that was a real bright spot in our go live week. So that was one variable that we saw as immediate efficiency. The other things that we saw within the first couple of weeks were efficiencies in the way that we were e-prescribing. A lot of our physicians had not been e-prescribing before, and they were immediately with the EMR product that we chose. The other piece that's related to that is their use of e-faxing. Now, when they complete an appointment with a patient, they e-fax that progress note immediately to the referring physician and anybody else that they need to copy on that document. Longer term, what we will see are efficiencies in the way that we communicate with the hospital. Interfaces are being built with the hospital for lab and radiology. We are also going live with what we refer to as a patient portal, where we have designed all of our intake forms to be input online when the patients are at home, so that ends up getting electronically sent and automatically imported into the patient's progress note. So that will eliminate data entry and things of that nature. And longer term as well, what we really hope for is a better understanding of our outcomes. Through outcomes analysis and data gathering, right now, or before EMR anyway, that would take countless hours in terms of chart reviews and things like that. So we're looking for long-term improvements in the area of outcomes analysis and proving what we do is effective.